What is up, party people? Today we're going to be going over when abnormal GnRH pulsation is the correct answer on USMLE. And really there's two types of patients they want you to associate this with. The first is going to be a female with a low BMI, possibly very active, means like training for like triathlon or running a marathon, or very active. It can be really any athlete with a decreased caloric intake and a decreased BMI. This is going to be the classic hypothalamic amenorrhea. So this basically disrupts gonadotropin-releasing hormone secretion from the hypothalamus, which leads to amenorrhea. It could also be labeled as abnormal GnRH pulsation or decreased GnRH pulsation. They'll show up both ways. So while the exact mechanism is not fully understood, basically the theory behind this is that decreased adipose tissue results in decreased estrogen production. And hormonal imbalances involving leptin and ghrelin are going to affect your appetite as well as your sensation of satiation. So at the end of the day, it doesn't really matter for USMLE. Just know that the decrease in BMI as well as the amenorrhea is going to be the result of decreased GnRH pulsation or abnormal GnRH pulsation. However, just keep in mind also, you could go on the opposite end of the spectrum where they give you a female, big girl alert, with a high BMI and PCOS, that's polycystic ovarian syndrome. And in this case, the increase in insulin resistance is resulting in increased androgen production, and this results in anovulation. Some distractor choices that they might give you in this type of question might be increased ACTH secretion. This specifically refers to Cushing's disease from the pituitary, or ectopic ACTH production, such as small cell lung cancer. However, don't get lost in the weeds. Another option they might give you is aromatization, androgens to estrogens via the enzyme aromatase, which is secreted by granulosa cells in females and Sertoli cells in males. Though aromatase plays a role in hormone balance, it's not the mechanism of amenorrhea in this scenario. Aromatase deficiency would present with androgen excess, not amenorrhea from low BMI. Another option would be ovarian follicles. This could be tempting if you're thinking about PCOS, where there are multiple small cystic follicles and anovulation. However, in this case, the girl had low BMI, not high, so this does not fit. And finally, they might even give you 5-alpha reductase deficiency. Now this condition leads to ambiguous genitalia at birth and virilization at puberty. The classic example would be a young girl, early teens, with increased growth and acne, as well as an enlarged clitoris. And quite frankly, it's really a phallus. This enzyme deficiency impairs the conversion of testosterone to DHT, that's dihydrotestosterone, which is critical for male external genitalia. At puberty, the testosterone surge can partially compensate, causing late onset virilization. Again, not relevant here. So one more time, the summary. For a low BMI girl with amenorrhea in the setting of intense physical activity as well as low calories, I want you thinking about abnormal GnRH pulsation, i.e. hypothalamic amenorrhea. Also, remember, the same mechanism applies to high BMI plus PCOS due to insulin resistance, which disrupts the GnRH pulsation. All right, that's it. Go crush it.